The top blood test often overlooked in evaluating hair loss: vitamin D. Whether you're experiencing hair loss, thinning, or reduced volume, understanding vitamin D's role could be a game changer. Let's dive in. First, let's talk about hair growth. The hair follicle isn't the hair itself. It's the cavity that supports it. Hair grows in stages: a growth phase, lasting 2 to 7 years, a transition phase, and finally, a rest phase when the hair releases, allowing new hair to grow. Many factors affect this process, such as scalp calcification and DHT, a strong form of testosterone that can shrink follicles and inhibit growth. Massaging the scalp to boost blood flow is a common solution to combat calcification. But here's where vitamin D is crucial. Often thought of as a vitamin, vitamin D is actually a hormone, playing a role in over 2,500 genes. Certain genes, like beta-catenin, which regulate hair development, depend on sufficient vitamin D levels to trigger hair growth. The presence of vitamin D receptors around hair follicles is also key, as they support optimal hair growth. Let's talk about autoimmune conditions like alopecia, which are often connected to low vitamin D. Without enough vitamin D, the immune system may struggle, potentially leading to hair-damaging conditions. Vitamin D, being a potent anti-inflammatory, helps regulate T cells, enabling them to differentiate between healthy cells and threats, which can prevent autoimmune responses that harm hair. Vitamin D deficiency also shows up in scalp conditions like psoriasis and dandruff, which respond well to anti-inflammatories. In fact, magnesium, another key nutrient, helps regulate calcium buildup on the scalp. Too much calcium can starve the hair of blood and oxygen, leading to hair loss. Magnesium supports vitamin D's function, helps prevent calcification, and is involved in 300 enzyme processes crucial to hair growth. While vitamin D is easy to test, magnesium levels are harder to measure accurately since only 1% of the body's magnesium is in the blood. Most is within cells. Doctors rarely order magnesium tests because standard blood tests aren't reliable indicators. So, how much vitamin D do you need for healthy hair? Optimal levels should be at least 70 nanograms per milliliter. Yet, because vitamin D also feeds bone health and various body systems, you may need to supplement consistently, especially if you lack daily sun exposure. Aim for at least 20,000 IU of vitamin D daily, with magnesium, vitamin K2, and zinc as cofactors. Don't worry, this amount is safe, comparable to sun exposure, and far from toxic. People with higher melanin, insulin resistance, obesity, or limited sun exposure are more prone to vitamin D deficiency, which is why regular testing and higher intake may be necessary. For optimal results, combine vitamin D with magnesium, 50 mg at night, to activate the vitamin and support calcium balance in the scalp. Besides vitamin D and magnesium, nutrients like zinc and iron play vital roles in hair health. Zinc aids growth and repair, while iron supports red blood cells that carry oxygen to hair follicles. For women experiencing heavy periods, iron loss is common, so consider red meat or liver for replenishment. Men too can face issues, as genetic tendencies to accumulate iron may lead to anemia, affecting hair health. In summary, if hair loss is a concern, consider vitamin D, magnesium, and other cofactors. These nutrients are not only essential for overall health but also vital for a full, healthy head of hair. Start with vitamin D and magnesium, monitor your levels, and watch for improvement in hair and scalp health.